Solpadeine Fast is a combined analgesic-antipyretic, contains a combination of two active ingredients, paracetamol and caffeine. Caffeine, which is part of the composition, stimulates the psychomotor centers of the brain, has an analeptic effect, enhances the effect of analgesics, eliminates drowsiness and fatigue, and increases physical and mental performance. Indications: headache, migraine, toothache, back pain, neuralgia, muscular and rheumatic pain, painful menstruation, sore throat. Symptomatic treatment of colds and flu to reduce elevated body temperature. How to use: soluble tablets Solpadeine Fast shall be dissolved in at least 100 ml, half a glass of water before ingestion. Adults, including the elderly and children over 12 years of age, are prescribed 1 to 2 tablets, 3 to 4 times per day if necessary. The interval between doses is at least 4 hours. The maximum single dose is 2 tablets. The maximum daily dose is 8 tablets. The drug is not recommended to be used for more than 5 days as an anesthetic and for more than 3 days as an antipyretic without prescription and supervision of a doctor. An increase in the daily dose of the drug or the duration of treatment is possible only under medical supervision. Contraindications: pronounced violations of liver function, severe violations of kidney function, arterial hypertension, glaucoma, sleep disorders, epilepsy, children's age up to 12 years, hypersensitivity to the components of the drug. Special instructions: if the condition does not improve while taking the drug or the headache becomes constant, you should consult a doctor. While taking the drug, excessive consumption of caffeinated foods, including tea, coffee, is not recommended. This can lead to restlessness, anxiety, irritability, insomnia, headache, gastrointestinal disorders, tachycardia, cardiac arrhythmias. The drug should not be taken simultaneously with other paracetamol-containing drugs. Side effects: at recommended doses, the drug is usually well tolerated. Allergic reactions, very rarely, skin rash, angioedema, Quincke's edema, Stevens-Johnson syndrome, anaphylaxis. From the hematopoietic system, very rarely, leukopenia, thrombocytopenia, methemoglobinemia, agranulocytosis, hemolytic anemia. From the respiratory system, very rarely, bronchospasm. In patients with hypersensitivity to acetylsalicylic acid and NSAIDs. From the hepatobiliary system, very rarely, impaired liver function. With prolonged use in high doses, the likelihood of hepatotoxicity, nephrotoxicity, and pancytopenia increases. Also, in cases of prolonged use in high doses, it is necessary to control the blood picture.